It's truly shocking and disgraceful. A country with the resources that we have should not be in this state. And I think above all else, the single factor that's leading to this is the lack of federal coordination and leadership. The fact that there is no steadying, unifying hand coming from the White House means that the country is forced to fight this pandemic as a bunch of disconnected states. And the response has therefore been weaker than the sum of its parts. That's why we're in this situation where entirely predictable patterns are emerging. The fact that we are in a globalized, urbanized world shouldn't be an excuse for America to look past its failings during this crisis. On top of those things that a lot of other countries share, we add this a strange healthcare system that ties health to unemployment. We add a long legacy of racial discrimination, which means that now Black and brown and indigenous people are suffering disproportionately. They're getting infected and dying from coronavirus far more than other people. We add a specific disinvestment in public health that is not universal, that is very much an American phenomenon, that we have become complacent. We have reduced the money that goes into the people who stop us from getting sick in the first place in favor of treating people who are already sick. And the combined burden of all of these choices left to fester and rot for decades is coming to fruition now. Now we're seeing the impact of all these things that people had talked about and could have been prevented and are making the pandemic so much worse.
Do you think if we had Medicare for all, a national health care system, that it would have dealt with the system much better and working against this patchwork approach in this country, Ed?
Yes. I think it's very clear that is the case. It's not going to be a panacea. It's not going to be the single thing that fixes everything. The problem with the pandemic is that the U.S. has floundered on multiple different fronts. Healthcare access is certainly one of them. There was a thing called the Global Health Security Index, which ranks different nations according to their preparedness. The U.S. ranked #1, which now, in hindsight, seems a bit dubious. But even then, in terms of healthcare access, it ranked 175th out of 195 countries, one of the worst in the world. So do I think that universal healthcare would have made a difference? Absolutely, as would other social policies, paid sick leave, hazard pay, things that would allow people the agency and power to take their health into their own hands, stop themselves from getting infected in a way that we know that poor and disadvantaged people currently are.